So Waldenström macroglobulinemia, it's a lymphoplasmacytic lymphoma. It's considered like similar in myeloma in certain aspects, but different in others. And it's usually produce IgM monoclonal protein, which is very specific to this disease. And we in that study we collected data from 439 patients. Again, it was like the largest asymptomatic cohort reported at that time, and we tried to look what are the biomarkers of progression. And we found 4 important biomarkers in the asymptomatic subgroup that were independent risk factors. One of them was the bone marrow infiltration, and the second was beta-2 microglobulin. Third was albumin, and also the the IgM level quantified by the level of immunoglobulin. And we found that these 4 factors are independent risks of progression. The higher they are, except for albumin, if it's lower, then the higher risk of progression to active Waldenström and requiring treatment. And then we developed actually a calculator, a tool that can be used by clinicians in the clinic so that they can plug in the values of these labs and biomarkers when they see patients in the clinic who are asymptomatic, and it gives them this patient, for example, belong to which risk category, if it's low risk, medium, or high risk. And these 3 risk groups had different risk of progression. Of a median, like for the low risk group, like 10 years, versus the higher risk were actually almost 1.6 or to 2 years. So it helps patients and it helps clinicians who see this rare disease to kind of manage that as well. And it helps us also understanding how we can avoid over-treating some patients, and at the same time having more follow-up for patients who we know that will be high-risk groups.